This is the SaveHeart Stories podcast. Real-life stories of lives saved and changed due to sudden cardiac arrest and the availability of life-saving AED devices. Because one life lost is too many, these stories matter. Here's your host, Dave Fritzsche.
Welcome to SaveHeart Stories. I'm your host, Dave Fritzsche. Thanks for joining us. I'm here to continually shine a light on the health epidemic and serial killer known as sudden cardiac arrest, or SCA. It's the largest natural cause of death in the United States, claiming almost 400,000 lives every year in the U.S. alone, which is over 1,000 people per day. SaveHeart Stories showcase real people and real events. We talk about where AEDs, or automated external defibrillators, were used to save lives, and also, unfortunately, where AEDs weren't used and lives were lost. We also talk to industry pioneers who have made a difference in their communities through their life-saving efforts. SaveHeart Stories are meant not only to share information, but also to call people to action to combat SCA and improve life-saving efforts everywhere. As we begin, I'd like to ask a favor. If you like this show, please hit the like button where you're watching or listening, and subscribe to future shows so you won't miss another SaveHeart story. This is important because it helps us get the word out and says that this show is worth listening to. Today, we are lucky to have on our show, on our SaveHeart Stories podcast, Kevin Knussman, member of the Talbot, Maryland Paramedic Foundation in Talbot County, Maryland, and founder of Advocacy for Early Defibrillation, or AED, a not-for-profit organization based in the Villages, Florida. Kevin has a long and storied career in emergency medical services. As a true professional and innovator, he was an original member of the Easton, Maryland Volunteer Fire Department's Advanced Life Support Pilot Program, and his leadership there gave rise to the first dedicated county-wide ALS program on the Eastern Shore. He later became president of the Talbot County Volunteer Fire and Rescue Association. His passion and vision to create a countywide EMS program operated by the county government for the people of Talbot County became a reality when the ALS program that he pioneered became part of the Talbot County Department of Emergency Services, who we work with at SaveHeart. And that's just his volunteer activities. Throughout most of his 23-year career with the Maryland State Police, Kevin was a flight paramedic trooper and was chosen to open the local MSP medevac helicopter called Trooper 6 in 1985. He also worked for 15 years for the Caroline County, Maryland Department of Emergency Services and spent the last 3 years of his EMS career with Kent County, Maryland EMS. He is currently retired in Florida, but you guessed it, he is still helping people through his roles on the Talbot Paramedic Foundation and as founder of Advocacy for Early Defibrillation, which is focused on enabling greater access to AEDs and improve community response time to combat sudden cardiac arrest emergencies. Kevin, with that long introduction, thank you for being our guest on the SaveHeart Stories podcast.
Thank you. Thank you for the introduction.
Sure. You know, what was your initial calling that drew you to become a first responder at that age and at that stage of your career?
I grew up in the 1970s. The show Emergency was in its heyday. That was impactful to me and so many others in my generation. So I think that is certainly a leading factor. My first assignment as a state trooper was in Prince George's County, Maryland, which is a metropolitan county. They had 3 medic units for the county, which is a massive county with a high population, but they had 3 advanced life support units there. And I rode for a while there while I was assigned at barrack was couple hours from my hometown, so I would go over there, and actually we had a bunks at the barracks so I could sleep there, and I would go to a local volunteer firehouse, and that's where I really got to experience my first on-scene provision of a provider providing advanced life support. I started an IV on a cardiac patient, put the cardiac monitor on, and I thought that's something I have to bring to my hometown. And so that was in this, 78, 79, 80, that I was in that assignment at Prince George's County. I actually went back home, and I was told by some of the volunteers, not all of them, but some of them, doctors only start IVs, and that's not something we'll ever do. Time marched on. I moved to a little larger community, Easton, Maryland, and the hospital was located there. Maryland is very blessed to have a very impactful state EMS program there, Maryland Institute of Emergency Medical Services, and we combined with the hospital, the local volunteer fire department, Easton Volunteer Fire Department, and the ladies auxiliary at the hospital, the junior auxiliary, I should say, provided some funding. They hired a coordinator, and 7 of us started training on the weekends to become providers. 5 of us successfully passed that course and began providing 24-hour services on a volunteer basis with a chase unit providing services to our community. Over the course of a year, we were able to get volunteers from every volunteer fire department in Talbot County, Maryland, to volunteer to take that same training. And we, after a lot of lobbying, got a $50,000 grant from our county council. And now it's the largest, aside from the public schools, it's the largest department in the county. They have, I think, 6 full-time transport units, a couple of supervisors, and I think they've probably got 50 paramedics and probably at least that many EMTs that run the program.
It's remarkable, as I've come to learn. I've been in the AED industry, of course, for 25 years, but as I came to learn about Talbot County, and I met you and Wayne Dyatt and really the remarkable people that are there, it is really a pioneer and a leading organization, area, whatever you want to call it, that without your and Wayne's leadership and dedication and, again, just long-standing commitment to public safety, it wouldn't have grown to where it is now. But it's really
all 5 of the neighboring counties basically copied the model that we had. So that was very rewarding. It was, and those resources now are available to every citizen. The resources are shared between counties. If there's a call where the adjoining county's unit is closer, or a call where they need multiple units, those units are shared among that region very easily.
So that's wonderful, and that's the way it should be, right? Sharing resources and really, leading to help people and save more lives. So the history you just went through about how things started and your involvement on the Eastern Shore, am I right in saying that up to that time, that was volunteer-based initially, and you also, of course, as I mentioned in my opening, had a really long-standing career, 23-year career with the Maryland State Police in the medevac unit. So were you working basically 6-7 days a week for many years on end to do both things?
I don't think it's quite that bad, but I will say that the volunteers were committed to what we were doing. We had, I think, understanding families for the large part. And so, you're attending meetings, you're going to training, the shift work that is involved with working for the Maryland State Police, it takes a lot of time and commitment. We had an immense amount of support and some opposition within the county, and fortunately, the other people that were in our group, both in the Easton pilot program and the county program, were truly heavy hitters within the community. And they were from the business community, they were from the medical community, and I got to say, I can pick out a couple individuals. There was an individual, Gary Jones, who actually passed away, suffered a sudden cardiac arrest out on a boat a couple of summers ago, and unfortunately didn't survive. But he was He was the chief of the cardiopulmonary services at the local hospital and had a background in respiratory therapy. He just had an immense amount of respect within the hospital community, within the community of physicians and nurses, and his wife was a nurse too, actually a PhD nurse in management at the hospital. Those kind of people had an impact. Wayne Dyatt, who you know is currently president of the Paramedic Foundation, he was director of the volunteer advanced life support group. Wayne had a background, he was a life member of the volunteer fire company. He and a businessman that ran a hotel, restaurant, and sports fishing company, Buddy Harrison, actually got elected to the county council after our success with the advanced life support program, and they both served a term on the county council. It was during their term on the county council that the county was willing to swallow us up and have a program that is successful way beyond what we could have done on any volunteer basis.
Yeah, well, you're so honorable to also shed the light on other people and tell their stories, and of course you're in that same.
And there were many more.
Yeah, I'm sure. I'm always struck in my continuous learning about Talbot County and really the greater Eastern Shore community of not only the history that you're going through, which is we're privileged to hear about, but also the kind of the different backgrounds of people. You mentioned the business people, the healthcare people, obviously the first responders like you and Wayne and others, and as it's grown and as I've come to know now, the outreach that the Paramedic Foundation, for instance, does to the local community that really supports through fundraising and awareness and initiatives, not just of placing AEDs, but of all of the other communications and awareness initiatives around first response. Is remarkable, and it really is a gold standard from what I've seen around the country. And then I think that also influences things like the Rotary Club getting involved. That's more from the business side, whole other network, and continues today. And that's why I'm going back this weekend to the Eastern Shore. There's a few other initiatives that have kind of grown out of, as you say, Talbot County's commitment to not only providing first response, but also just greater awareness in the community in general. And I'll also be visiting with some of the neighboring counties, which you mentioned also.
Yes.
That have kind of
and the Talbot Paramedic Foundation has the larger mission of keeping the emergency medical services program as a top-rate program, with state-of-the-art equipment, the best training. So we will partner with the county council. We have partners, Team Trace, which you're very much aware of. So we've done things like purchase in part LifePak 15s. Now we're looking at replacing LifePak 15s with the next generation of LifePak monitor defibrillators. We've provided ultrasounds to all the paramedic units. And we've provided training. We've contributed to that. We've done a number of things as the Paramedic Foundation, but we can only do that with the support of Rotary, VFW, American Legion, Lions Club, and anybody else that will partner with us. Team Trace actually has been 50-50 in funding our public access defibrillator program, which was the national leader, and has worked to put AEDs out in all the public spaces, the parks and recreational facilities that are within 90 seconds, I guess. It's three. We want the AED to be at the patient side within 3 minutes. So brisk
3-minute rule.
One way to get the unit and back to the patient. And before that, though, we've got about 250 AEDs out in the community. And so I guess I want to circle around and say it is truly a community effort. We've got all the local police agencies have AEDs in their vehicles. so that when dispatch receives a call for cardiac arrest, the police are dispatched on that call, as well as the volunteer fire rescue system, and as well as the county paramedics. 2 paramedic units and a supervisor, so that's 5 career people plus the volunteers respond. There are still a couple of volunteer ambulance programs that will respond within the county, and we depend on all those people. That's what survival is all about, and we've had not only success. We've had great success. The local YMCA's had, I think, 3 or 4 saves over the years, and we always make sure we recognize those people. You can have upwards of 30 people or 35 people that are participating in a successful cardiac arrest outcome, and it goes everywhere from the person at the patient's side. We had a son that delivered CPR to his father. Police officer responded, gave successful shocks with the AED. The EMS crew, the volunteer firefighters responded. The patient was transported to the local hospital, and they bypassed the emergency department and go directly into the cath lab and had stents put in. This individual survived. Not only did he survive, he had almost no, maybe even no negative outcomes from his blockage and his cardiac arrest, and we're seeing that type of success. So yeah, it's a program that's worthwhile. I know one of the areas you're going to want to talk about are the holes in the system. There's still holes in the system, and I think really less than 40% of the people that have cardiac arrest in public spaces receive CPR. And back to that, if they get CPR and they get that shock within the first 5 minutes, you're talking about 90% can be saved.
It's unbelievable, the difference, as you well know, more than just about anybody out there. The CPR is so critical to keep the blood flowing and to really buy time, right, until the therapy, so to speak, from the AED.
Right.
Whether it be a lay responder that's grabbing it from an outdoor cabinet or an indoor cabinet, or the professional that has it, whether it's a policeman that has it in his car driving, out in the community, or a ambulance first responder. That CPR buys the critical time so that therapy or the shock from the AED can actually save someone. But the stats are remarkable. And we are going to be speaking, by the way, with Wayne Dyott here over the next week or two. Similar, obviously, background and story, but also from his perspective about Talbot and some of the things he's seen. But I wanted to transition, if it's okay. Like I say, even though you're quote unquote retired, I know you're still busy at work, and it was wonderful to meet you and your team at Advocates for Early Defibrillation, AED, which is, of course, a phenomenal name for your not-for-profit, down in the Villages, Florida, and meeting them last year. Tell me what excites you most now at this stage of your career, with all that you've done and all that you know, to take those lessons and your energy now to help the public and help survival stories out down in Florida. Tell us a little bit about Advocates for Early Defibrillation.
Based on my experience in Talbot, I knew it was possible to have a nonprofit that was successful in advocating for increased access to early defibrillation. And here in the Villages, they have a really unique program that's, I guess it's probably 20 years old now or more. The Villages, for those people that don't know, it's the fastest growing retirement community maybe in the world. There's now over 150,000 people here that are 55 and over. They have they have probably 100 golf courses and recreational centers, and they've got a dozen softball fields, and so they've got and pickleball courts that I don't know how many pickleball courts they have, but there's a lot of active people here trying to be healthy into their later life. They, as I said, about 20 years ago, they formed this unique program where they wanted to deliver AEDs to the patient's side following a cardiac arrest, and they came up with a way that the local dispatch center would blindly alert based on the geocoding of a neighborhood through a company called Ready Alert, out of Orlando, Florida, where they get text and phone calls with an automated message of the address where the cardiac arrest is. And the neighborhoods can be as small as, my neighborhood's maybe about 70 homes. We have 2 AEDs that are located on each end of the group of homes and we typically get maybe 1 cardiac arrest a year. Now we've partnered with a neighboring community that has about 75 homes. So, between those homes, about one call a year. They have 2 AEDs and probably 12 providers. We have about 10 providers in our neighborhood that get jointly alerted. And this is replicated throughout the villages. The trend has been even as high as 1,500 homes. It's been the groups have been larger. They're all volunteer. They're not incorporated. It's just a very informal thing. Not every community has it, but it's been expanding and certainly a successful program. I like the program because it was groundbreaking. It delivers that AED to the home and to the patient side, and it's provided by volunteers, neighbors, and most often they get there before EMS.
Right.
Interestingly, EMS is a huge priority in this community, and they just last year completely replaced their private system of transport with first response fire rescue. They put in like 9 or maybe even a dozen transport units within the main county that's part of the villages, and their response time is incredibly fast, and they are really good. They're all hazards, and they respond to EMS calls. Probably, I bet 95% of their total calls are EMS related, and so they're very, very much geared to that. We're very fortunate to have that in really all 3 counties that the villages are part of have great EMS systems. So back to the holes that I was telling you about. The Neighbor Saving Neighbor, as it's called, responds to the various communities that have the program, to the residential cardiac arrest. That leaves us with a lot of holes in the community. Recreational facilities, community squares where people dance. There's music 365 days a year at there's currently 4, I think there's planned 5 community squares. And I think that those people that are in the public spaces need to have the opportunity to have the AED and the CPR. When you're only seeing 40% of those people get CPR, and I might add, particularly women and people of color are much less likely to receive CPR. Now, there's some different reasons. They think women, it's because people don't want to touch them or bare their chest.
Right.
People of color, I think there's less certain areas of concern there. Maybe it's where they experience a cardiac arrest, or it might be some darker feelings about that, about why people are less likely to intervene in those situations. But we can change that. We can change that with education. One of the big things with this movement is people do not need to be trained and certified to be a provider at a CPR AED to use it to provide that.
That's right.
The 911 centers are instructing people to do hands-only CPR. They're asking them if they have an AED available. The movement is to make the AED accessible, visible, and accessible. So when you walk in, I'll give Publix is a great example. They all have AEDs. The Publix is the main grocery store down here.
Oh, yeah.
They all have AEDs at the front of their business. I understand by third-hand information. The reason they have that is they had a cardiac arrest at one of their stores and they didn't have an AED. This was before AEDs, and they had a bad outcome. Now they all have AEDs, and it's a priority for their business. And so you say, okay, how do we take that AED and make it available in a circumference from that location beyond the store or beyond the location? You could have a Chinese restaurant, let's say, 2 doors down, and with a cardiac arrest. How would you get the AED from the Publix to the cardiac arrest? And unless you actually have knowledge that the AED's there, how would you have that notification on the phone? A company called Pulse Point is working on that. Another company, Avive, has some communities, the 4-minute communities that they've put together. I know you're familiar with that.
Yep, absolutely.
The technology is there to close those, and I think that's the next big challenge of how that's going to happen, how people are going to receive notifications. The Avives, there's a couple communities. Cumberland County, Pennsylvania, has a program where they're putting AEDs in the hands of people out in the community that are willing to go to a cardiac arrest. And again, the geocoding allows for that AED, and perhaps if the person has an app on their phone, a notification to say cardiac arrest nearby, and they're actually directed to take the AED to wherever their close cardiac arrest is. That to me is the next step. How do we pull the AEDs that are in the community together? You're certainly involved with the ability to mount AEDs in areas that the weather doesn't permit the AED to be out in the middle of a park, because you now have heated enclosures. That's what Talbot County, Maryland's doing.
Absolutely.
That's what
and fully monitored, to your point.
Spearfish, South Dakota, has been very active. That's another community that has been at the forefront with community response to sudden cardiac arrest. And there's hundreds of others. There's hundreds of others out there, maybe thousands.
Well, Kevin, and that's why it's so important to have people like you on the program on SaveHeart Stories, because number one, you bring up so many important points, right? Having more AEDs, like you're talking about, finding the gaps that you've brought up, closing them, be it lay responder action, CPR. You've brought up beyond just placing more AEDs out there, including outdoors, which is a new frontier that we at SaveHeart are really laser focused on. But it's also then about the awareness of where they are, the education, which you and advocates for early defibrillation are involved in all these areas. But then it's about the communication and the 24/7 monitoring, either of the unit itself or of where it is, so that then there's immediate communications to those responders, be they professionals or lay responders, through people like organizations like Pulse Point and Avive and some others. SaveHeart, that's utilizing technology with the Avia cabinet that has that immediate notification, so that time, which we mentioned earlier was critical, can get the right people there with the right technology to save lives. Because as you mentioned, it can go from the 10%, unfortunately, average survival rate across the country now to as great as 90% or more, just by having those other pieces in place and those gaps filled. So it's really remarkable, and people like yourself that have led these things for really decades, and now doing it in new areas like the villages.
And the thing I always explain to groups when I'm speaking to them is, if the chemistry of the body deteriorates so rapidly that if you don't deliver the shock within the first 5 minutes, by the time EMS gets there, it's often too late. And EMS is really chasing after something that probably isn't there. But their whole goal is, in a cardiac arrest, is to get back to a shockable rhythm. So if you can intervene with that AED before EMS gets there and before the chemistry of the body deteriorates, where the body can accept that shock and start a pulse again, to start the heart with a return of spontaneous circulation, you've you've taken care of what EMS is going to be trying to do anyway, because they're going to be given epinephrine and, doing other procedures to try to get the shockable rhythm back. And it's just too late.
Yep. Getting the lay responders to take action, which you are so involved in and have been for so long, before the professionals get there, and hopefully they're already saved. Excuse me. Well, listen, I just wanted to, Kevin, again, say what a pleasure it is to talk with you. We really appreciate you being on SaveHeart Stories to share your experiences, your stories, your recommendations. I know you and I are going to stay in close contact as we do on opportunities to achieve our joint missions. And, just in closing, how can people learn more about you and Advocates for Early Defibrillation?
Well,
so they can learn more.
Advocates for Early Defibrillation has, it's a startup where we have virtually no money.
I know the feeling.
We're beating the drums. Our priority is to work with local community groups and go out and talk to them and get some donations, to get some funding, to get started. But mostly we've identified local churches that we'd like to work with to make sure their congregations are safe and that they have AEDs, and the AEDs are checked, because that's another thing. You just can't hang it on the wall. But that's a great way to reach out to people that say, okay, if I know it here, I always tell them, if you're at Publix or you're at Walmart, there's an AED there. You can use it. You have to, ask for it. So we have a Facebook page, Advocates for Early Defibrillation, and certainly people can go on there. Our email contact is on there. Shoot us an email if we have anything of value. We just right now our programs are basically advocacy and education, and we're looking for that next phase where maybe we have some grant money, or we're able to work with some individuals that can provide us donations to dedicate it toward placement of AEDs. The Talbot Paramedic Foundation is certainly a leader in community response to sudden cardiac arrest. They have a very active Facebook page and also a web page, Talbot Paramedic Foundation. And you can get a lot of good information on there. I would really encourage anybody that has a community that does not have a foundation that's dedicated toward emergency services, emergency medical services, AEDs, to take a look at that model, that you actually have the ability as a foundation to advocate and provide a link between the public employees, often, or some communities have private companies, but you, as a foundation, you can reach out and access funding that often is not available through the government. People are willing to donate. A lot of times, memorial donations fill that void of purchasing an AED in memory of some loved one. So, yeah, please reach out.
Absolutely.
Yep.
And Kevin, we can, of course, through SaveHeart.life, there's my dog. She's excited about this show too, or the mailman. At any rate, we are going to be showcasing, of course, this conversation on our SaveHeart Stories podcast and blog, and through our channels, and we'll point back, of course, to Advocates for Early Defibrillation and Talbot Paramedic Foundation, as we will continue to do with you and others throughout our journey. But I really wanted to thank our guest, Kevin Knussman, and thank you all for listening to our show. You can hear more SaveHeart Stories at www.saveheartstories.com, or wherever you stream your favorite shows. And to learn more about SaveHeart products and services, or to contact me directly and get in touch with people like Kevin and his organization, please visit www.saveheart.life. Until then, again, Kevin, thank you.
It's a fight worth waging. Thank you.
Yes, absolutely. We always sign off with saying, be grateful every day, and we look forward to seeing you next time. Thank you, sir. Take care, everybody.
This has been the SaveHeart Stories podcast with Dave Fritzsche, AED industry veteran and founder of SaveHeart by Heart Nation. To learn more about how outdoor AEDs can keep your community safer, call 312-953-6928 or email Dave at SaveHeart.life. Proudly made in the USA, SaveHeart's highly visible, alarmed, lighted, temperature-controlled, and 24/7 monitored outdoor cabinets provide immediate visibility and access to life-saving AEDs. Stop the bleed kits, Narcan, and other emergency supplies. They are ideal for parks, athletic fields, trails, schools and universities, marinas, business districts, and any outdoor locations where people congregate. Click on www.saveheart.life for more information. SaveHeart Stories is a presentation of SaveHeart by Heart Nation.